As we get close to the end of Women's Emphasis Month, a few ladies decided to still practice social distance and have a Zoom meeting to discuss COVID-19. Our very first question is, what is COVID-19, or should I say, how do we get the name COVID-19?
CO stands for corona, the VI stands for the virus, and the D stands for disease. And the 19 itself is just, that was the disease that started in 2019. So that's where we get COVID-19, the coronavirus. And in looking at the coronavirus, a question may have come up: how is COVID-19 transmitted personally? How has it affected you?
With me, I am that social butterfly person. I like to be in the midst of a lot of different things. So it has affected me in some way. I still get a chance to kind of hang out with my family, but not my bigger family. Just my parents and my siblings, and that's it.
Okay, so you just get to hang out with your immediate family. You're not able to, visit friends and things like that.
Go out to dinner or lunch and, the movies, or just kind of that kind of hangout.
I mean, thinking for all of us, it has kept everybody isolated. It affects us. We can't attend church and interact with my church family. Jan has not been able to get out or be around people. Basically, she's been shut up in the house since March. We'll go through the drive-thru to get something to eat. And I think it has affected me to the point where you're anxious more than what you used to be, because with my job, I have to go to people's houses. I have to interact with different people, and you don't know what anybody else has, and everybody is not cautious and careful, and it just makes you more anxious and more nervous when you have to be out there. You can't do the things. You're not carefree and relaxed.
Right.
You got to constantly be aware of your surroundings, and you got to constantly be aware of somebody else coughing and sneezing because they don't have on a mask, and you may have on one, but when you don't know, they really don't know how this disease is actually spread. Everybody's giving their viewpoint and their ideas, but they really don't know how this disease is actually spread. Everybody's giving their viewpoint and their ideas, but there is nothing guaranteed that it's not passed. You're touching surfaces. You on my job, is one bathroom for the men and women. Everybody has to go to that one bathroom.
Wow.
One. So you go in with your napkin, with your hand sanitizer. They got stuff in there to spray. You spray every time you go in. You spray when you come out. So it's just makes you a little bit more anxious and extra careful.
Right, extra careful.
Mm-hmm.
And Sister Howard, I know you work you work around a lot of people. How has it affected you all at work?
Well, at work, you have to do things that people ask. It's mandatory that you wear a mask in the office, because there have been 3 or 4 people that had the virus. And right now we have government entities that are shut down because people don't wear the mask, and they were allowing people to come in that didn't wear a mask. So it's really crazy. 200,000 people die and people still don't wear a mask. Right. So simple. Yeah. So my son had the virus, and he lost 30 pounds in 1 week.
Wow.
Yes. But he survived it. But yes, he needs to follow, like Dr. Mac Bowman said, it affects your heart. So, he have to follow up with seeing checkup and stuff like that. But yeah.
Wow.
Yeah.
And I know I have a cousin, younger cousin. I mean, he is what I think he may have just turned 38. Now he had COVID, and the way he found out, he was walking around, and he said he started feeling bad, all of a sudden. But now he did notice that he had lost his sense of smell, and he noticed that he had lost his, started losing taste. But he was at work and passed out. When he passed out and
Wow.
they took him to the hospital, they kept him in the hospital. But now, and it's been about 3 weeks since he has been cleared to go back to work and everything. And just the other day, they said, well, they thought he had a stroke. It was still a
Oh,
stroke,
wow.
but they called it what did they call it? Bell palsy. They said that he had Bell palsy, and it was a side effect of the coronavirus.
Wow.
So,
Mhm.
it is something. It's something. Anybody else want to talk about how it has affected them personally?
Miss Drayton can't get her to come up, so she's gonna talk off of my telephone.
Okay.
Okay.
Hey y'all.
Hi.
Hi.
Miss Drayton.
Hey, I just wanted to say that it's affected me in the fact that working in the medical field, you surrounded by all different entities of from one spectrum to the other. If it ain't the patient and the staff who's been contracted the virus from somewhere, and you really don't know who has it wherever you go. So it's always good to practice that simple thing: is the good hand washing, cover your mouth, wear a face mask, and now it's been studied, been shown that the cloth masks without a filter are not really good.
Wow.
Surgical masks are good. The N95 are really, really, really good. But wear something is better than nothing. And I just tell you, I really, honestly, truly, I had a panic attack. I've been exposed several times. I've had panic attacks in my 44 years of nursing. I've never had a panic attack like this.
Wow.
I don't know if it got to do with my age or what, but I have been. I've worked with HIV patients and sticking and drawing blood. They ain't never phased me, but this, because it's so unknown. Now there's,
Right.
have you recovered from the virus? A lot of people have all kind of illness after the fact. So it's just like, where does it end? Can you fully recover? There's a lot of unknown.
Right.
So that makes it a little even scarier. And the fact that you can't communicate with your loved ones, you can't travel, you got people far off, you can't go see them because you're scared to get an airplane. It's so many ways that it affected me. Yeah, funerals, people whom you lost during this time.
Yes.
And you can't get any closure because you didn't get to go to the funeral. You didn't get. I mean, it's been a testing time for us all. But God.
But God. Well, now let me flip this question. Let me flip the question a little bit. Does anybody see a benefit that the COVID-19 has brought to us?
Yeah, more people going to church.
That's true.
Benefits and blessings.
And I think families have gotten closer because you don't have to be out there. You really got quality time to spend together and to talk.
Right.
And to get to know each other.
Absolutely. And I think
I think that has made a difference.
Yeah.
Right.
Everybody should really have a good savings account. Because we shouldn't be spending any money with gas.
I know you're right.
Yeah, you save money. You don't shop. You don't go out. You got extra money.
I have not.
Because you're not buying as much gas.
Right.
For a couple of months, we didn't buy gas because we weren't really going anywhere. Clothes. I bought like maybe 4 items since January. So, yeah.
And I know for me, this COVID-19 made me realize I can do a lot more than what I have been doing.
Absolutely.
It's been some things, baking my little pies and my cakes and all these things that I wasn't doing, and realizing how much money I could have been saving had I been doing some of these things myself versus, going out and buying them.
One of my friends.
That's right.
One of my friends said that's what she was talking about, how she started cooking because she really didn't cook. But she started cooking, and one day she said she went through the drive-thru and I forget where she went, to McDonald's or somewhere, and she didn't realize how nasty the food was.
Yeah.
Not the same as home cook.
I know
No,
that's
yeah.
Nope.
right.
Mm.
And I want to ask Miss Drayton a question, since I know she was one of the healthcare personnel we had on the phone. When should a person return back to work after being sick from COVID-19? Or but not just to work, but just being amongst the population of people
Okay,
after.
they've been saying initially it's 14 days, but I know some healthcare providers said 10 days. So,
Mhm.
so they keep. That's what I'm saying. This thing's so unknown. They keep
Changing.
changing.
Right.
So, but I stayed out. I was quarantined because I was exposed. I stayed out 14 days.
Okay.
But didn't I just hear something on the news today saying something about they can go to work if
That's
The
something?
why I
governor
asked the
said
question.
teachers,
That's what I was
even though
saying.
teachers might be asymptomatic, they can report to the classroom and stay in
Yeah.
the class.
That's why
Yes.
I asked the question, because they
Yeah.
were saying asymptomatic. I mean,
Yes.
They say at the beginning they say 2 to 14 days. That's like
Right.
incubation period. If you don't have any other symptoms or in that between that time, then you should be clear 2 to 14
Mhm.
days. So that's why they say once you get tested and you say you are negative, then you got 14 days still to quarantine.
okay. We do on at home to help fight against the disease.
They don't usually once if you don't have any symptoms, they don't send you to the hospital. You
Okay.
stay home and quarantine at home because you're gonna get sicker. You go to the hospital.
Okay. So now, what if you have some symptoms? What are some things? I know.
Depends on how life they are.
Okay.
Just like if you got a respiratory problem, if you can't breathe, quite naturally you're gonna have to go to the hospital for some type of treatment if you can't breathe.
Okay.
Now, but for as just being tired, some people are tired and a low sense of taste and smell and all that stuff. But the most life-threatening one would be your respiratory, and then that affects your heart and and if you that way, if you sick enough to that you can't breathe well or you having problems with your chest hurt or anything, you need to be in the hospital.
Okay.
But the only thing we could do for the people who are at home if they don't have any life-threatening symptoms, because when I was tested, I have underlying conditions.
Okay.
I'm over 59. Oh,
Go on and tell the truth.
and
Stay right there. Stay right there.
I have sarcoidosis of the lungs. I'm diabetic. I'm hypertensive. This could go on, but
Right.
that will. So if you have somebody like that, like I said, the doctor said if I felt any kind of way, felt bad to go to the emergency room after I was tested negative. That's because if you got some kind of respiratory problem, you want to be treated quickly.
Mm-hmm. Mm-hmm.
You don't want to go on the ventilator if you can help it, but sometimes that's the only thing that can keep you.
Okay. So now, what about like being exposed to the sun? Because I know in some things that I've read, they said, try to get as much sunlight as possible, drink plenty of water,
That's
get a
they,
lot of vitamin C.
my understanding is that vitamins,
Okay.
some people I've heard, different minerals and vitamins are helpful. So I take vitamins anyway before this started. But if you hadn't been, because it's your immune system.
Right.
So if you boosted up your immune system by taking vitamins, that should help. And if you're not taking vitamins, I think everybody should start taking them. Be careful now. You can overdo it in vitamins as well.
Right.
So I would speak to my primary care physician, or don't try to Google everything.
Right.
I heard this guy, he was a survivor on I think it was like on CNN. It was on some news feed, and that's what he talked about as vitamin D, getting a lot of sun. And he talked about fluids like green tea,
Yeah.
water,
Warm green tea.
lemon, and he talked about just keeping your body in motion. He said he was I forget what stage or whatever it is that he had, but he described his body like on the inside was broken glass, and that's how it hurt. And he was saying, but it doesn't matter, you still need to move. He said some people get really, really sleepy, as he did, because he was a survivor. He was only in his 30s. And I'm trying to find that video. I'm trying to send it to everybody. And he was just talking about how he fought through it. But he fought, but he had to move. He said it hurt, but he had to get, he was in the hospital, and he just told them to get him out of that bed. And he went for walks and walks and walks, and he survived. So that's some of the things that he was saying he did to survive.
Wow. Okay. Well, now, ladies, anybody else have anything they would like to share as far as COVID-19 is concerned?
I think we need to understand how this affects you mentally, not just your
Right.
mental health.
Right.
Many people are depressed now and anxiety now and committing suicide now because of COVID, people have lost jobs and homes and everything, and people are just don't know how to cope mentally.
Right.
And I think mental health is going to shoot through the roof because of COVID, because so many people are going so much, and the fact that losing loved ones and you can't be there to say goodbye. And
That's right.
so many things that this disease has affected people, but mentally it is getting rough and rougher.
Wow.
Yeah.
You gotta take care of yourself mentally. You gotta talk to you gotta tell people how you feeling. If it's fears, if it's anxiety, whatever it is, you need to share it so that you can help somebody else cope and deal with it, because it's something that's affecting people so much mentally, and people are just on medication now more and more. People are, the anxiety is much worse. And, social anxiety is terrible. And this is just even worse, because now you can't even interact. I have a young lady that I work with. She didn't get out anyway, but now she can't get out. So it's a double whammy for her. And she's extremely depressed, and cries and cries. And it wears on us mentally. To have to see people go through stuff and you can't change it, you can't fix it. And it's mind-boggling.
Right.
Let me just iterate on Miss Beverly. Just today at work, we were talking about how mental health, how the doctors are leaving, doctors are dying, nurses are leaving, nurses are.
I saw that.
And they're sending. I just got an email tonight about they asking for retired nurses, retired health professionals to come back to help out because it's so short now. Because if they haven't passed away, they're leaving.
Wow.
Wow.
Like that on our job, we went from having, there's always been a shortage, but we only have 2 part-time nurses and for 5 counties.
Wow.
5 counties. And same for us counselors. It's people are being overworked. People
That's a lot, yes.
Absolutely.
And it's hard to
running them out.
Yeah.
Ooh, honey. I be want to tell my
God.
It's rough.
Yeah.
I work at the jail, and sometimes we're working 6 days a week. So we're working overtime, and the sheriff came in and told us that the ones who were supposed to come to work had to come to work because the same one keep working. They're being overworked, and them started to work. They're still at work. Some of them are just out of fear. They're not sick, but they're afraid of what's going on. And with COVID in the jail, and it's hard to keep things under control when even the inmates are at fear.
Wow.
So we have to deal with all this fear plus what's going on with the inmates. But we're being
Wow.
over, and we're working 12 hours a day.
Wow.
Six,
Wow.
So I mean,
yeah.
it's affecting every aspect of life.
It is.
This COVID-19, it's just
Mhm.
it's doing a whammy on all of us. Wow.
I
Well,
have
Yeah.
hello, can y'all hear me?
yes, ma'am. We
Yes.
can see you too.
Okay. Yeah, I have we have some ladies that work under us, and it is really difficult to get clients seen during this time. Clients are getting mad, and then some of them, if one person goes to see them, because our job is to get them covered. But then when one aide is out and you got to get another one to go in to do the visit, they're canceling visits, which I do understand. But then, it's like everybody is just so different. It look like they're beginning to get angry. They're taking out their frustrations on any and everybody. And so, I've had one lady, I'm in a new office now. I had one lady that has been affected twice by the virus. And she's like, she just really don't know whether she want to come back to work when she get through this process right now, because this is her second time having it.
You're saying she has caught the virus twice.
Yes.
No, I thought you could not catch it but once.
Yeah, they discovered you
No,
can catch
ma'am,
it more
that's
than
not true.
once.
Yeah.
Yes.
Yes, it's on the news today.
Wow.
But this lady at our job, this is her second go around with it as well. One of our custodians.
Oh my.
Yeah.
Okay. Wow. I'm glad you all shared that with me. Well, ladies,
Let me
our
ask Miss
time.
Drayton a
Oh,
question.
go ahead.
Miss Drayton,
Yes, ma'am.
what do you think about this new thing? I read in the paper today that they're approved for people to give plasma that
Yes.
just get over COVID.
Right. Right. They found a study that it helps if you've been COVID positive and your plasma and you survive and you're doing well. They want you to give your plasma because it got some kind of antibodies in it that will help the ones who are COVID positive people.
That's what they're doing at the Red Cross, and I'm like, I don't know about that.
I don't know about that either, because that's not
Yeah.
enough. I mean, they hadn't had that much.
Yeah.
I think they use plasma for a lot of other things, a lot of different things that not just your blood. They get the plasma out of it.
Right.
Out of your
But
blood.
if you're giving the plasma, this guy was just getting over COVID, and they said it was perfectly okay.
Ooh,
So,
And they're gonna inject that with some. They're gonna inject someone with it.
oh,
I'm a little dangerous to me.
Wow.
Wow.
Now they just like if you go in and give a blood, they test your blood for HIV and all stuff. They test your blood.
okay.
So I don't know for a fact, but they would test the blood once they give it. They can't go on the fact that and you don't have no documentation. And just like I was saying earlier that you can get reinfected, you can have it more than one time a day. So who knows? This is why it's so scary, because it's so
you don't know.
Yeah.
All uncertain. Yeah. It's trial and error.
Yeah.
Now, this is going to be my last question, and then the floor is just open to anybody else. But now, when they come up with the vaccine, are we just going to take the first vaccine that they come up with?
Well, I'm not taking any. Period.
They're having a hard time to get
No, ma'am.
African Americans to
I'm not.
volunteer.
I'm so serious. I am so serious.
I'm with you, Lisa.
I take my chances.
I'm not gonna go to the experiment. No. Yeah.
Anybody on the line take flu vaccines or
I've
pneumonia vaccines?
never taken it. I've never done it.
I don't never.
I've
No.
never done it.
Now,
I haven't
I take
either.
I take the vaccine. I do because, like I said, I'm respiratory, so I take it, and they advise. Okay, the winter's coming up, and they advise everybody to take the flu. At least take your flu shot now.
No.
Before the COVID comes, so you
I
won't be.
can't take the shot. I have a allergic reaction to it.
I researched that stuff that's in that flu. I won't. I would not have that injected in my body. I'd rather take my chances
Me too.
and whatever.
Me too.
Because if people would research that stuff, you won't want that stuff in your body because you don't know. No, ma'am. I'm so sorry. Not me.
No.
You will, but if you somebody like who have got underlying conditions, I've had the flu before and I died. So
Mama did.
I choose. It's your choice. But what they're saying is trying to push the thing that if people who taken the flu shot, if you want to take it, go ahead and take it now, because this pandemic stuff is when the winter comes, it's going to be compounded more so. But at least you won't have that problem. I mean, that thing to worry about.
Yeah. Mom had that flu shot one year, and she was sick for like 3.5 months.
Oh my goodness.
From that flu shot maybe about 4 or 5 years ago. I have never taken
shot, and I was in the emergency room. So no, the doctor told me that I couldn't take it because I'm allergic to it. So I can't take the flu shot. Not to take the flu shot.
Wow. Zan, I hear you, girl.
Zan said no flu shot for her either.
They gets her flu shot every year. She's gotten them forever.
Oh, Jesus.
She's gotten the flu shot, so she's always got one, but I don't get one. I just have never started because I feel like I've never had the flu. I've never had a reason to.
Right.
But
Well, this concludes our discussion of COVID-19. We'd like to thank everyone for participating, and we're going to leave you with a few reminders. Please continue to wash your hands, wear your face coverings, practice social distancing, avoid large crowds because your family needs you and we need you. We love you. Good night.